Okay. Thank you for joining us today. Early this morning, I announced that Ontario has confirmed its second presumptive case of Wuhan novel coronavirus. In many ways, this new case isn't surprising, as is the case of the wife of the first presumptive case, which I would say now we have confirmed that case. This individual, the first case that is, has been confirmed. This individual has been in close proximity to her husband, and having also arrived to Toronto from the area of the Wuhan as well, has also been exposed to the virus, potentially in China as well. I'd like to stress that since arriving in Toronto, this individual has been in self-isolation. As such, the risk to Ontarians remains low. Indeed, all necessary protocols are in place to actively monitor, detect, and contain the spread of this virus. We're working closely with all levels of government to ensure a coordinated and effective response. The second case also reminds us that not all people who contract Wuhan novel coronavirus experience severe symptoms. As of today, she has not been in need of the same acute hospital care required by her husband, who also remains stable. The province is working alongside Toronto Public Health, who has been in regular contact with the individual during their self-isolation period. I'm pleased to say we're joined today by Dr. Eileen Davila, who is the Medical Officer of Health for Toronto. And I also have my Associate Chief Medical Officer of Health, Dr. Barbara Yaffe, who has joined me also here today. Generally, we talk about some things overall in our approach on coronavirus. We have briefed you already on that before, but we're happy later in the conversation to answer questions specifically about the coronavirus as you feel the need to. But I know many of you, I have briefed you in a previous one on this topic. One thing we want to be clear about is the different roles and responsibilities that are undertaken. And the Ministry of Health has the provincial response coordinates the response to the 2019 novel coronavirus issue. Situational updates regarding the province, case counts, etc., testing are given out by the province. And statements and advice from the Minister are given through myself and the Chief Medical Officer of Health and the Minister when appropriate, and our other communications through our Medical Emergency Operations Centre. We work in affiliation and partnership with the Public Health Agency of Canada, and they are coordinating the national response to this. So we are in communication with the Chief Public Health Officer of Canada and our counterparts on a daily basis, and when appropriate, more often during the day. Questions related to the federal government's work and the global response, we anticipate through them and their role on committees such as the WHO and in responsible with international health regulations. Matters related to travel advisories, we wait for their advice and direction that they receive often from WHO in coordination with experts, and other aspects related to federal jurisdictions as well as international airports. Public Health Ontario is our lead scientific body with both the advice on scientific case management as well as with our public health laboratory system, which, as you've heard, has developed the test that we have undertaken to identify our two presumptive, now one confirmed case here in Ontario. Our public health units, and you're going to hear more how that works with Dr. Eileen Davila, are then have protocols and guidelines and aspects in place to carry out the investigation of any contacts, as well as people under investigation, to coordinate the data because it is reportable to local medical officers of health from all health professionals, laboratory, and hospital staff if they have a presumptive or they think is a probable or confirmed case of novel coronavirus. And the hospitals, they have all their operations and procedures. They have developed those through all their infection prevention control documents that we've put out judiciously over the last many years. And they have put those all in place. They're undertaking to, audit those, see what their status of training, knowledge of their staff, making sure everybody's up to speed on that. And also their supplies and equipment. They're going through that at this time as they continue to get in a state of preparation for dealing with any aspects of the novel coronavirus. So I'm going to hand things over to Dr. Yaffe, who's going to give you an update of the status globally and on Ontario at this time.
Thank you very much, Dr. Williams. As you know, on January 9th, the World Health Organization announced the identification of a new coronavirus, which is now called 2019-nCoV, linked to a cluster of viral pneumonia in Wuhan, China. As of today, there have been 2,799 cases reported globally, the vast majority in China, with 80 deaths. There have been a number of cases in several countries now, and all those cases in other countries have been travel-related. We do know there has been evidence of limited transmission human to human in close contacts. Cases, as I say, elsewhere have all been imported with a travel history to Wuhan or surrounding areas. Currently, Ontario now has 2 cases. One has just been, as of this morning, confirmed by the National Microbiology Lab in Winnipeg, and that is the male who's at Sunnybrook. The wife now is considered presumptive confirmed, i.e., her test is positive at the Public Health Ontario laboratories, and specimens are being sent to the National Lab for final confirmation. We also have 19 persons under investigation for whom results are pending, and we have ruled out about 15 or 16 as well. So the good news here is that there is ongoing active monitoring, people are self-identifying, and we continue to make sure the system is working. The 2 cases are, as you know, a married couple who arrived at Pearson International Airport on January 22nd. The first individual arrived at Sunnybrook Health Sciences Center on January 23rd by ambulance. The paramedics arrived in appropriate personal protective equipment at the patient's home. Upon arrival, the patient was placed in isolation in a negative pressure room, and he remains in stable condition. The second individual is his wife. She is on home isolation, and she is well. Toronto Public Health staff had conducted the testing on her and used appropriate precautions. So I'm going to now turn it over to Dr. Davila to give us an update on the work by Toronto Public Health.
So thank you very much. First, I would like to thank Dr. Williams and Dr. Yaffe, 1 for setting the context and 2 for providing the update. But perhaps most importantly, I'd like to thank them for all the collaboration that has happened over the course of the last several days. Since we were notified of this particular case at Toronto Public Health, I can tell you that our staff at Toronto Public Health have been working hard, virtually nonstop, to do that which we do in public health, to respond to a novel infectious disease and make sure that we're doing the best we can to protect the health of our community. And so I think it's important that you know that has been the efforts of your local public health department. And so I'd like to thank the staff of Toronto Public Health for all they've done, all their diligent work over the last several days. I would be remiss as well if I didn't speak of the work of my colleagues. I can assure you that every single day we have been in contact with our partners at the province, with the respective teams of Dr. Williams and Dr. Yaffe, our colleagues at Public Health Ontario, our colleagues at Public Health Agency of Canada. This truly is, a multi-party effort, each with our own respective roles, and we are all working together to make sure that we're providing the best service to our communities. I would also like to say at this point that, we understand that when we're talking about a novel virus, an emerging infectious disease, that this gives rise to certain uncertainties and many questions as a result. Relatively new virus, only identified about a month ago, and still much learning that's happening through the various investigations as different health authorities all around the world, including those in China, investigate their respective cases and the contacts. So we're constantly learning and updating our knowledge in respect of this novel virus. However, I must comment that it is done, and it has been done in this particular situation, incredibly quickly. This new virus was only identified about a month ago, and so to have this much information and this much understanding and this much knowledge shared globally, I think is actually quite remarkable and a positive statement on the international public health community. So with respect to that which we're doing at Toronto Public Health, Dr. Williams has given you a sense as to the roles and responsibilities. But to put it briefly, at Toronto Public Health, our efforts, as I've stated many times, have been focused on what we call case management and contact tracing. So working with the ill individual, that first presumptive or now confirmed case, to understand the circumstances of their illness, so that we in turn can identify those who are close contacts and therefore at risk of having been exposed to the disease. So that one, they're aware of their exposure, they're informed as to what signs and symptoms they should be monitoring themselves for, and that they're given the necessary information, the information they need to know, so that if they develop signs and symptoms, they know what to do to protect their health and to protect the health of others. So while we talk about this in public health terms with rather clinical language like case management or contact tracing, I would like to remind members of the public that while you have many questions and many concerns, which are all perfectly understandable, we still do have an ill individual who is recovering in hospital from illness. And I know that we've all had that experience of being ill ourselves or having an ill family member in hospital. So I would respectfully ask the public to please respect the privacy of the individual and allow them that opportunity to recover in hospital from their sickness. With that, I'll wrap up my remarks and turn it back over to you, Dr. Williams.
Thank you, Dr. Davila. So the aspect...
Actually, if there's just one comment I will make before we turn it back, which is as of this morning,
Thank you.
Ontario implemented enhanced screening measures at all emergency medical services communication centers to help identify potential cases of this Wuhan novel coronavirus before dispatching paramedics. So I just wanted to make sure of that.
Thank you. Important point. We will take questions and answer in a moment. I'll just finish up, wrap up here. So, as you see, we have a small number of presumptive and confirmed cases, just 2. And that's not unexpected. We expected to see that. I would guess we're going to see some more cases reported, other parts of Ontario perhaps. And that the new case is close proximity to Ontario's first case, it was not surprising that we might find that. And that's due to the diligence of Toronto Public Health undertaking their contact tracing and testing the client, respecting privacy as well as giving advice and direction to that person on their ongoing self-isolation. And will continue to do so on an ongoing basis. To ensure the readiness, the ministry has moved ahead with comprehensive preparedness if the situation should escalate. These activities build on our previous work on other infectious diseases. So as Dr. DeVille's noted, and Dr. Yaffe, this is part of our protocols and guidelines and directions. It's part of our business, the day-to-day work of doing these infectious disease management, case management, contact tracing, etc., is part of the day-to-day work. Preparedness is such that we are well ahead of where we were back in 2003, what everybody thinks about with SARS. It's a different world, a different era now. So the system is prepared to investigate, manage any persons under investigation, contact tracing, any confirmed or presumptive confirmed cases. So we're already on that level there. Next steps is that we continue to provide guidance to the health sector, all our partners. We have many teleconferences, many conversations so that their concerns are answered, their questions are dealt with, and we make sure that all the sectors are prepared and able to respond to anything that might come our way in the future. The Ontarians are informed that it still is of low risk to Ontarians in general, and that's through the diligent work of, like Toronto Public Health and other health departments, as they carry out the job of following any case under investigation or contact tracing. We have twice weekly briefings on a case basis there. We have regular teleconferences. We're going to daily on some cases there with key stakeholders, other partners in our healthcare sector. We're also having consultation at the national level with the Chief Public Health Officer of Canada, and we have regular meetings that are going to be started on that basis so that both she and all the other CMOHs, Chief Medical Officer Health in the country, are at the same level and we understand what's going on, so keep everybody informed. We also have our web pages up. We have our telehealth information so that the public can inquire, at different sources, including the local health department, if they have questions or concerns, as Dr. Davila has alluded to. So that's our current status at this stage here. And so we'd be happy to take questions now to either any of the three of us on that.
Elaborate on the enhanced screening that you mentioned. So that is in hospital emergency rooms, or is that in family doctors as well? Where is all that, and what's the detail?
Well, I can speak to the emergency medical services dispatch, which is when you call 911. Dispatch answers the phone, and if the individual has respiratory symptoms, they will ask about a travel history. And so if there's a concern that this person may be infected, the paramedics that are sent out are aware and wear appropriate garb, which of course is what happened with our original case.
Can you tell us about the family, the two people traveling? Were there other members of their family also traveling with them to China? And how are they doing and how are they being treated?
Dr. DeVille, answer that.
Sure. So I'm happy to take that question. So it was just those two travelers, and we're following up with all close contacts. There are no other household contacts.
What does home quarantine actually mean?
So actually, what we're talking about here in this particular case is we have an individual who is staying at home because she's sick. And again, this is good practice for anybody, particularly at this season of our year, cold and flu season, following good infection prevention and control advice. If you're sick and you have respiratory symptoms of a viral respiratory illness, cough, sore throat, fever, and the like, best advice is to stay at home so that you can prevent transmitting the disease that you have, whatever it is. Keep in mind that when we're talking about novel coronavirus, here in Toronto, the risk in our community continues to remain low. But there are other respiratory viruses, as we expect at this time of year, and the best advice for any respiratory illness, anyone who has symptoms of a respiratory illness, is to stay home to prevent the spread of that disease. Get some rest, get fluids, so that you can recover appropriately.
I do want to get to this question here that you want to fuzz
Well,
there?
perhaps we should follow that up. So, absolutely. When there are circumstances, of course, in any respiratory disease process, where somebody may find themselves in a situation where they need medical attention, certainly things like not getting better, or in fact, I should say, getting worse, feeling worse, having significant difficulty breathing, ongoing fever. But this is no different than the usual advice that we give to people in respect of respiratory viruses. Best thing to do is to stay home if you're ill, so as to prevent transmission or to prevent spread of disease, and also to allow yourself the opportunity to recover. And of course, if your situation is getting worse, best to seek healthcare attention. Now, in this particular situation, always good to let your healthcare provider, when you're coming in with a respiratory disease, one, of what your symptoms are, and two, given our current circumstances, if there is a travel history, that would certainly be information that would be beneficial and should be provided to healthcare providers, ideally in advance.
Many people are wondering how the man who came from Wuhan, was exhibiting some mild symptoms on the plane, was actually able to go home. Does there need to be greater screening at the airport? How was he allowed to slip through when we knew that this was a possibility?
Well, the information that we had received initially that the person was not symptomatic on the flight. They arrived back. We understood they had both worn masks throughout the whole flight. And took transportation in a separate vehicle, and we understand that person was wearing a mask as well, which the person does anyways, and they went straight to their house. He became more symptomatic in the next 24 hours, and then had a family member not come to the house, call 911, and that person gave clear advice and direction to 911, and paramedics responded appropriately.
What happened at the airport when they landed? Was each traveler questioned when they arrived in Toronto?
There is a signage up, and they also had to go through the kiosk and ask. They get asked about, have you had symptoms? Have you and so on? Where have you been? I'm guessing that the person may not have felt that ill, And of course, who doesn't feel lousy after a 16-hour flight? So trying to differentiate, am I really sick or not? And having worn a mask, went home. However, acted very responsibly after that. When he became ill, he felt sick, he developed a fever, he called his son, everybody was informed appropriately. There's no perfect screening system in an airport. In fact, in SARS, we were doing thermal screening in the airport, and it was found to be totally ineffective.
How does
What's
the
the
person
asked
after
if they
they
went to Wuhan?
Dr. Williams?
Just to follow up to that question, please.
Okay, follow up, okay.
Was the person asked if they had been in Wuhan, and if so, what was the response? And if not, why weren't they asked, I guess?
Go ahead.
I mean, the signage would have said that. I don't know exactly what they said, to be honest with you.
Were the screening
Can
processes in
tell
place
us
on Wednesday,
how about
though?
all the traveler on the plane? Other passenger?
So the screening processes last week, the Greater Toronto Airport Authority with Health Canada set up the signage first. And by later in the week on the Friday, they had put in the kiosk questions. They were going through training up all their borderland security staff as well as their quarantine officers and setting up facilities at the airport where they could see individuals to ask them questions in a discreet and private way. So that was all being put in by the end of last week. How that timed with their actual arrival, what was actually there at the time, I'm not sure of, but it all was in process of getting in place, if that answers your question.
The 2004 report after the SARS outbreak in 2003 found that there was a shortage of infection control practitioners, and that contributed to the spread in Toronto. Do you feel that at this time that has been mitigated, or is there still a need for more of those professionals in hospitals across Ontario?
Since 2003-04, with the work of the Provincial Infectious Disease Advisory Committee, the whole thing of developing regional infection control resources, the amount of staff trained and in place is immensely larger than before. All hospitals are equipped with it. It is a main priority of most hospitals, all hospitals on a day-to-day basis, to ensure that their IPAC, infection prevention and control processes are in place. They have guidelines and protocols, train of staff. So all they do have infection control committees, and they have infection control practitioners. So that's a huge change since 2003-04.
Sorry, I can add to that. I think that an important point for the Toronto context in particular is that we actually have very strong and established relationships with each of our hospitals and their infection prevention and control. And in fact, much credit goes to Dr. Yaffe for that, as she was one of the major instigators and promoters behind that particular establishment of our communicable disease liaison unit. So we have extremely well-established connections with our infection prevention and control experts in each and every one of our hospitals.
And we should add that Public Health Ontario has infection prevention control experts and help to coordinate those on a provincial basis, giving advice and direction. So Public Health Agency, which was not in place in 2003, is there to do that. And they do that on a regular basis, investigating any concerns around infection prevention control breach or concerns, and giving scientific advice in that regard. I was waiting to get patient over to you, sorry.
I have two quick questions for you and then a follow-up for you, Dr. Yaffe. During the incubation stage where there are no signs or symptoms, can that disease or virus be passed on at that stage? And if so, how do we prevent symptomless spreaders from passing on that virus?
It's a good question, and I know Dr. Villa noted this is a new and emerging disease. We've been trying to get advice and direction from the WHO. So far from Public Health Agency of Canada, their position is that if someone does not have symptoms, they usually are not shedding. That's a good starting point, and we're continuing to ask if there's any question on that, because we always want to see is there any issues and concerns on that. So that is our working case definition at this time and how we follow that. So in that incubation period, and then how long is the period that we're concerned afterwards. We're working on a working pattern of 10 to 14 on the precautionary outside basis. But as they learn more in China, as the WHO and experts learn more, we are waiting to be informed if there's any change to that. But that's the position that we've been given at this time, and our scientific experts continue to review that matter. And as Dr. DeVille alluded to, now that we have 2 cases here, it allows our healthcare practitioners and science people to look at those, and maybe we can contribute to the international knowledge base on that to further the science about this novel new virus.
Great
Just
segue
wondering
into
if you
a
can
follow-up
go
question.
through, if you can
Sorry?
go through
It's a
the
good segue
numbers.
into my follow-up question I have
Yes.
had for you, and then a quick one for Dr. Yaffe.
Okay, we'll get back. Yes, sorry.
I'm just wondering if you can go through the numbers one more time here, and also just elaborate a bit on the pending cases. So it's one case of coronavirus that has been confirmed, one presumptive, 19 pending, and approximately 16 ruled out. Is that correct?
19 people under investigation.
Under investigation. So can you kind of elaborate on that, and also what hospitals those folks are at?
The people under investigation come from various parts. It depends on through our reportability aspects that different health units may have it in their jurisdiction. Quite a few are in Toronto. I can't say how many, and that is not an important issue. Each health department in their area are looking into those in conjunction with healthcare provider, emergency department staff, etc., who are taking samples and submitting. So part of the process with all these people under investigation, as Dr. Davila has noted, this is flu season. So they'll undertake a variety of tests. One, assess what is their clinical state, what is their travel history, does it fit the case definition, yes or no. Next, what kind of tests will they run? A battery of viral tests of common ones that are circulating at this time. Those take time to come in. And of course, they have the request to put in our special novel corona to the Public Health Laboratory here in Ontario, and they undertake that process. As we go through that ruling in and ruling out, those people under investigation are moved to, if it's negative, then there are other causes, may have influenza, other viruses, and those are like the 15 that we talked about already. So that process is undertaken in various places in Ontario through the reportability process that the minister passed regulations last week. And so all the health departments, including Toronto, is prepared and equipped to undertake and orchestrate that process to rule in or rule out people under investigation as being a concern for novel coronavirus at this time.
All of the 19 have a travel history.
Our assumption is they're a person under investigation. Our case definition is that they have, one, signs and symptoms of a respiratory condition, and they have what we concern a travel history that is of importance, which is to Wuhan or around the district in the Hubei province. So we're working on those. Public Health Ontario, PHAC, or Public Health Canada, may change with WHO any travel. We're waiting to hear updates. That's our working definition. This time, that can change as the international experts put those on. But as you know, WHO has met last week. We're waiting to see if they're going to meet again and alter any things.
How long does it take? How long does it take? Contacting the passengers who are on the radius on the airplane?
To do the tests in
Can you
Ontario?
update us on the progress to contact the passengers on the airplane, please?
We'll cover two things. One, the testing.
How long does it take to do the testing in Ontario? And there obviously have been cuts to public health. Are those cutbacks impeding or slowing down the testing for patients with possible coronavirus?
No, there's no compromise in public health response to deal with it. The testing itself, we've said before, the actual handling of the test once it's received in a public health laboratory in Ontario takes 24 to 36 hours. If it comes back positive by our testing, then as Dr. Yaffe has already alluded to, a sample immediately is sent to the National Microbiological Laboratory in Winnipeg, and that usually takes them, once receipt of the sample, another 48 hours to come up with their final answer. Meanwhile, while those are running in parallel, there's sometimes what we call other viral panels or tests for common ones such as normal coronavirus, influenza. I can give you a bunch of names of viruses, but this is all that's circulating, and hospitals and labs are equipped with those panels, if you may, to do that testing to rule in or rule out other common respiratory viruses at this time.
And while those tests are being done, are the possible patients, are they in self-isolation? Are they in isolation in hospital? What's happening before we know the outcome of those tests?
Well, I'm going to ask Dr. Davila to comment on that, but generally the public health official and that person dealing with them, and including the health official, will give them advice depending on their situation and their signs and symptoms. Most of the time it's to stay at home because if they're unwell, as we've been heard, you should stay at home and do self-isolation. That means limit your contact with family members, in the public, etc. There's different things you can give advice on. So while that's pending, if they have enough to merit a travel history as well as signs and symptoms, we would expect them to be following those ideas. And whether Dr. Bill wants to comment further, because they're involved in a number of people under investigation management cases.
Yeah, so clearly, I mean, you're trying to manage two different aspects of that particular clinical situation. First is to make sure that we're getting an appropriate diagnosis for the ill individual. And second, of course, is to prevent the spread of disease to others. So as Dr. Williams rightfully points out, it will depend on the circumstances. How sick are you? Are you already in hospital, or are you able to manage in the community? But regardless, the notion is to ensure that the opportunity for spread is limited.
Can you give tracing the patients, though, Dr. Davila? That's your responsibility, right, to follow up on my colleague's question. How are you doing on tracing the patients who were on the airplane?
So as I've indicated in my earlier remarks, staff at Toronto Public Health have been working flat out since we were notified to identify close contacts of the ill individual and to make sure that they have the information. I'll look forward as I go back to the office to hear the latest update.
That doesn't answer my question. You say you're working flat out. How many of the patients on the plane have you identified and made contact with? And why haven't you, why didn't you also just simply, on Saturday, when you said that you knew which plane the person was on, why not make a public call out to all of those people to come and contact you? Because I understand from that the passengers on that plane are chatting amongst themselves, and a lot of them are quite concerned.
Yes, and as I've said, I do appreciate that there are going to be many concerns as we're talking about a novel virus. But, we have and we do investigate these kinds of situations on a regular basis, and we have experience in terms of addressing close contacts in the context of an airplane. So using the practices that are known to us and ones that we deploy on a regular basis, we are actively following up with those close contacts. We have been able to make contact with a few. We do know that there is a mobile population here, and we may very well need to go to a more public call. But it's a question of trying to make sure that we're balancing all the concerns, including privacy concerns in this particular situation. So please rest assured that we are using tried and true methods in respect of managing and following up on infectious diseases. This is something we do on a regular basis, each and every day.
So those passengers should be self-isolated? Those passengers on the plane should be self-isolated?
No, so what we're telling people is, and we're looking particularly first and foremost, our responsibility is to provide active follow-up of those who are deemed to be close contacts. And in this kind of situation, it's going to be those who are within a certain distance or were within a certain distance of the ill passenger. And the idea is to get in contact with them so that they're aware of exposure, and that they're aware of what signs and symptoms they should be looking for, and then to advise them that should you develop those signs and symptoms, here's what your next steps look like, and to help them establish a contact with local public health. For all other passengers of that plane, those that we are not contacting or actively following up, at this stage of the game, the best advice, premised on the evidence in respect of this particular virus, what we're asking them to do is to continue about their regular business. Should they develop signs and symptoms, we are asking them to contact their local public health unit and to stay home, as we tell everybody who has a respiratory illness or symptoms of respiratory illness. Stay home, prevent spread of whatever sickness it is you may have, keeping in mind that it is cold and flu season. So this is good advice regardless of the circumstance. In this situation, we would ask those who were on the plane to contact their local public health unit to offer further guidance around what should be done next. And what that looks like will depend on the circumstances.
Given the fact that the second patient is now the wife of the first patient, looking back on it now, do you think that should have been handled a little bit differently? And with regards to self-isolation, should Ontarians, Torontonians be comfortable with somebody policing themselves when it comes to deciding whether to isolate themselves or not?
Well, I think when we look at this particular circumstance, as you've heard through various reports and here by Dr. Yaffe, in this situation, we had people who were conscious of the fact that there was a respiratory symptom. Let's talk about the first case. Identified that they were feeling unwell and required medical follow-up, healthcare intervention. They made the call and made sure that healthcare providers were aware of what their circumstances were. So we have been in regular contact, and we have every reason to believe that there continues to be appropriate follow-up on our part with respect to this second case. And we understand as well that thankfully she is well and currently asymptomatic.
Are we comfortable with self-isolation? Like, should we be comfortable with that?
I think that in this particular circumstance, we're seeing that we're getting good cooperation from people. I think we have to deal with the situations that present themselves as they present themselves so that we apply the best intervention or action from a public health perspective in order to prevent transmission of disease.
I would add to that is that public health will assess each situation. If an individual is in self-isolation for a period of time, they'll assess what's their capacity to do so. Do they need some assistance because they may want food, they may need help. There's things you can do so they're not forced to go back out in the public and break that self-isolation. So each situation is unique, but you have to understand the client and make sure you address that and meet their needs, because we're there to help them, to rule in or rule out. They want to find out, we want to find out, and their cooperation and participation is vitally important, and we want to assist in that. I want to go to the gentleman at the back here who's been waiting patiently.
Just wondering if Dr. Davila could take us through how many investigators you have at Toronto Public Health actually out there trying to find out how many people could be affected by this, and also if Dr. Williams and Dr. Yaffe might be able to say the same thing outside the city.
So what I can't give you an exact number. We certainly have a team that's specifically identified to do this work. And in fact, we've pulled extra resources. We're actually making sure that the team is well staffed. I would also say to you that we do work in partnership with other local public health units. And so over and above the collaboration and the continuous communication that has happened between ourselves at Toronto Public Health, the province, Public Health Ontario, and the federal partners, we've also had regular communications with our partners from other local public health units as needed.
And I would add that, as Dr. DeVille noted, the province is doing their part and also working very tightly with the federal government to say, how do we get as much information as Dr. DeVille and her staff need as quickly as possible to undertake this important job. And so we're trying to equip our local public health departments with what they need to know to do this job. So there's lots of people on the ground.
Measures taken at schools. I know during SARS there was extra money put into schools and they took extra precautions with extra cleaning. Are we at that stage where anything extra needs to be done in schools today?
No, at this stage, unlike SARS, we don't have it widely circulating in the community. We have our case management that we're carrying out here. If there was concerns, Dr. Davila or myself or Dr. Yaffe would be telling them so. At this time, there's still lots of respiratory viruses out there. There's lots of influenza-like illness. Our rules are still the same. If your child is ill, keep them at home because you want to protect your child, let them get better. They may have to be assessed. At the same time, you don't want the other children to be infected by your child, whether it's influenza or anything else. That includes whether, because it's a respiratory, if you have a travel history and you're concerned about that, the same point. You talk to your local health department, your primary care doctor, or your emergency department for advice on what to do. So right now, those are situations, the same things that schools do now, especially in junior grades about cleaning toys and stuff like that, is what they do on a regular basis, especially during this time of flu season. It's business as usual.
And there's one school that's asking parents to keep their children home if they've been to China or have traveled or somebody in the family has. Do you agree with that measure?
In discussion with the Ministry of Education, we have not heard if that's been sanctioned by the ministry at this time. So right now they've given, I've sent a letter out to all the directors and to their principals, et cetera, and given them advice, similar to what Dr. DeVilla has sent out to her schools and to the Toronto District School Board and other boards in Toronto. So it's basically business as usual in that sense. So we have continued to ratify that message.
Does the confirmed patient have children? The couple, do they have children? And if so, are they in school?
They're in their own household, and that's it. There are no other members of that household.
Just an update on the condition of the first patient?
We understand the first patient, and Dr. Villa's staff has been in contact with the hospital on that, and from the hospital officials that he is continuing to recover and is stable. And should have anything further to add on that, but we continue to monitor that situation with the Sunnybrook officials.
And did I understand that his wife, pardon me, she's asymptomatic?
That's my understanding.
How is she being monitored since she is staying at home? Is it a public health?
We have regular contact.
What's that mean, regular contact?
We call and check in.
Okay, but is it obviously somebody has had to go to her directly to get the sample to be able to take it to the lab?
Yes,
so.
yes. And as you heard from Dr. Yaffe, that was done under complete precautions.
Dr.
The gentleman at the back, yes?
What do I do to keep myself, I'm healthy. How do I keep myself healthy? I don't want to buy a stupid mask. What do I have to do to stay healthy?
Well, staying healthy this time of season,
How do I contract this? How do I
right,
protect this?
same as any other respiratory virus at this time. That means you're cautious around in the social activities. If you have something, we're asking everybody else to do the same, because we've become pretty good at Ontario at our cough etiquette, and we're known for that, cough into our sleeve. People carry on hand hygiene. I hear sometimes in public transit people coughing, and someone looks at me and says, it's an allergy, I'm handling this. So everybody's quite open about that. If you have concerns with your own health, of course, you'd want to be responsible yourself and stay home. Those messages have been solid. They're excellent to follow in that light there. And so we want everybody to do their part in doing that. And I think it has been successful in that sign there, because we try to limit that. And of course, during flu season, we want you to get vaccinated before the flu season, and people have come forward, but we still like more to come forward and get it done. So those are things you can do to protect yourself during this flu season. Yes, thank you.
So health officials are relying a lot on individuals in this whole situation. People looking at the signs at the airport, people putting themselves in self-isolation, reporting their symptoms. But in this case, this first case, this couple came through the airport, they saw all the signs, they did not follow those signs, they didn't talk about the symptoms that they had. So how reliable is that system in terms of getting people to sort of do what you want them to do when it comes to reporting this?
I think as Dr. Villain noted, while they might have read the signs, they're aware of the situation. When they got home, they did not go and have any contacts with any other people. In fact, when the husband became ill, he contacted a family member who said, I'm not coming over, and they took the serious information seriously and responded appropriately. So just because one at that moment isn't going to follow the sign, because I don't have it right this time, as Dr. Yaffe said, may have been feeling feel lousy after a long flight, but got home and said, I saw what the sign said, this is a serious issue, and we're going to handle it accordingly. Because the advice is not just at that moment, it's ongoing. Now, if you're coming back from those countries, you're asymptomatic, you don't have to declare it. But even a few days, and you knew you were in Wuhan, or the Hubei province, and you start feeling well, you saw the notice. And then you take the appropriate action and call. So that's what it's all about. And because we really rely on individuals to be responsible, and for the most part, we see they are concerned. They are concerned about their health. They're concerned about their family's health. And they want to be socially responsible. And we've seen that happen again and again, including the cases that we've seen in the States. The self-identification has been critically important, as Dr. Yaffe said. Screening only does so much. But we need our citizens to be responsible in that level, and for the most part, we see that.
If I could just add, I would like to add to that. For those of us who went through SARS, we quarantined thousands of people, and we had excellent cooperation. I have presented on their experience to the Americans. They're always amazed how cooperative Canadians are. And of course, that's a generalization. But, in general, most people will cooperate. They're concerned for their own health and the health of their families. And if, airport screening is only one measure, it's not going to be the full complement of measures.
Okay, sorry.
More details about the couple. Do we know their exact ages?
I think We know mostly in their, it's in slightly older. Of course, I don't want to say too old.
Mid-50s.
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 And do we know, did she contract the virus, because they both went to Wuhan, correct? Did she contract the virus from there, or do we know if she contracted it from her husband? How did it spread?
At this time, we don't know. We're trying to investigate. We know that she has a positive test. We know she's had potentially exposure in Wuhan and potentially exposure. Which one, it may be difficult to determine in that case, but we're asking our scientists those type of questions.
And just one more. Of the 19 who are under investigation, I just wanted to clarify, so the 15 and 16 who have been cleared, that's not a subset of the 19, right? You have 19 under investigation. What are they currently under investigation for? I mean, do we know that they travel to Wuhan? Or do they just have the signs and symptoms?
So in order to be tested and counted as a person under investigation, as Dr. Williams said, they have to meet the case definition. So they have to have symptoms, fever, cough, and so on, and have traveled to Wuhan or surrounding areas within 14 days. And so otherwise, they will not get tested.
Were any of them on the plane?
I don't know. But this is the labs doing this testing, and most of them are coming back, as was said, with influenza or some other virus.
I would think, as Dr. DeVille is going to comment, as she identifies, some of those may become people under investigation. We'll leave that for her department to note us with.
But I think that there is an important point here, and there was a question that was asked around protecting oneself. So Dr. Williams is quite right. The best way to protect oneself from respiratory viruses are all those good basic hygiene practices that you hear about year after year. Right? It is cold and flu season. What do? The best things to do, get your annual flu shot. Wash your hands regularly. And if you can't get access to soap and water to wash your hands, use an alcohol-based hand sanitizer. Try not to touch your face and mouth that much, because that's a very effective way to bring viruses into your system. Cover your cough or sneeze. And those are the elements that are core and fundamental to respiratory virus prevention. I would be remiss, of course, if I didn't mention that staying home when one is sick is also one of the cornerstones with respect to respiratory virus prevention and preventing the spread of disease. However, you will note that the case definition, as Dr. Yaffe pointed out, involves a history of travel to affected areas of China. Mm-hmm. So with respect to this current novel coronavirus, that is what we're talking about in respect of major risk factor. So just to answer that question on preventing risk and seeking to reduce risk around novel coronavirus, the major risk factor is travel to the affected parts of the world. That being said, we don't want people to stop using good respiratory hygiene. It is cold and flu season. These are good practices to use all the time. But please keep in mind that that's we have that case definition for a reason.
I know this question's been asked, but I'm wondering if you could just elaborate with more details, if you can, about how ill the patient at Sunnybrook is, sort of what his symptoms might be, if that's possible, and follow to that, with a novel virus, how will you know, or how will doctors know when this man can be discharged, when he's, free of the virus?
We, in consultation with Sunnybrook officials, we understood that he had some chest condition that was concerning. They felt he was recovering without a lot of supportive issues there, so they're optimistic. The question of discharge is an important one. We want to have those conversations with them, as well as others, to say, okay, because just like his wife, once one is well enough, one can go home and continue on self-isolation until one is deemed to be no longer infectious, and that's we're trying to work on those definitions right now on that.
Yeah. And do you even know when someone will not be infectious?
We're waiting for advice and direction in the science of a novel virus. We're still waiting for that. The gentleman in the back there.
You've mentioned quite a lot, influenza and other respiratory illnesses. How would you, based on what we know about this new coronavirus, how would you compare it to the seasonal flu in terms of virulence and ease of transmissibility, that kind of thing, if you were to sort of rate them in terms of a public health threat, I guess?
I know my counterpart at Public Health Ontario, Dr. Donnelly, the scientists and the international specialists say the numbers are still too small to give that real idea of communicability. There's technical terms for that. I'm not going to get into details. At the moment, it seems to be somewhat less than like influenza A and that aspect there, and some other ones at this time. We still need to see more, like how has it moved among regular citizens around the country in that aspect there. So we're trying to get that information from China and with the international experts from WHO to try and tell us better what that is. But when we watch it, when they move, people who have moved from the affected areas to other cities in China, as of yet the Chinese officials have not reported secondary spread in there, except sometimes with a close family member, much like the case we have here. So that's what tells us it's not quite as movable, as communicable as some of the others, which can move widespread. But I would say caution, it's still early days. We still want to be advised by that on evidence and science so we know how to give the correct advice and direction. So we are really waiting for that international information to come our way. We will try to understand it best from our perspective.
The severity of the illness, is it similar to flu or more serious or less so?
The other aspect on that one there is that so far a lot of the deaths we see or we hear of in China have been mostly related to individuals who are somewhat older and who have other health conditions, much like we see here in Ontario or Canada with influenza. How its mortality rate is, difficult to say on a population-wide basis. In that, we hear some numbers tossed around. Again, for the average person in the street, getting it, some have very mild illness. We understand it's over fairly quickly. They may have a good innate immune system, and others have other conditions. So what is the mortality based on a population basis? We don't know. It seems to be low, but it's still too early to make conclusions on that matter at this time. And certainly with people with chronic disease and conditions, much like with the influenza and other respiratory viruses, they're more prone to severe consequences, including, unfortunately, death.
China has imposed travel restrictions within their own country, several cities lockdown and so on. Now other countries are looking at doing travel restrictions with China. Should we be looking at travel restrictions for flights coming in from China? We've got up to a dozen a day at different times, very large planes. Could be importing more cases.
That's the question that we asked, and that was what WHO was trying to address last week. If it's an international emergency, should they put travel advisories on? They have been confident so far that the Chinese officials have put quite strict limitations on movement within the country, some of which I haven't seen to that level in previous experience. And you're talking like millions of people being cordoned off and not allowed to move between different sites. They feel confident they're containing that within their jurisdiction. The WHO will meet again when they need to address that. We rest on the advice of the WHO, as other countries around the world are, to say, do we want to put anything further on that or not? And right now, we are listening to the experts, listening to public agencies in Canada and the WHO to get advice and direction on that matter. So we haven't, and others are waiting for that information as well.
Can I ask you a very quick question? We've heard a couple of times now that the first responders that responded to the first call were advised of what they were getting into with regards to the potential for the coronavirus. The paramedics union has tweeted something differently, saying that they were not advised. Any idea why the discrepancy?
No, that would be a question I would ask the paramedics union. I'm not sure what the genesis or what the rationale for their tweet. I haven't read their tweet, and I don't know what the rationale for their tweet is.
I believe the concern is that they were aware of the condition of the client, and they wore proper PPE as they always do. They felt that they didn't hear about the presumptive confirmed case, which doesn't affect their protocols at all. But that was one of the concerns, and we're trying to work on that better. We're getting all communication flowing out so that everybody can know as soon as possible. But it was fairly quick from when we knew at 1 o'clock, and we did broad media, so everybody knew. But we try to inform as many people as quickly as we can. But in essence, that did not and should not affect their handling, whether it was novel corona or any other respiratory virus, because they're wearing their proper personal protective equipment as per their protocols and their standards that are strictly required for the job. And they did. And that's the most important thing for their protection.
Not
I
too
want to ask
long
about the
ago.
19 people under the under the persons or the people under investigation? I think Barbara Yaffe, you were saying that you don't know if these 19 people were on the plane. So on that one plane, or is it any plane? And does that mean that it's possible that if you don't know that they're on the plane, that we've already got person-to-person spread in Canada?
Those 19 people, the vast majority are in hospital and in precautions. And the lab result comes within 24 hours. So far, something like 30 are negative or have other organisms. Now we have the 2. So as soon as we were to get a presumptive positive on any of them, obviously we would do all the follow-up that we would need to do.
And some of the other cases, some of the other people on investigation in other parts of the province, again, may have had a travel history to the affected area and came in well back a week ago or whatever, and now they develop symptoms, and they have reported to either their primary care physician, to emergency department, or the public health department, and they're being investigated the same as Dr. DeVille has alluded to here by my fellow MOHs around the province and their staff doing their part in that regard. So they don't have to be related to this case in particular, because we have other people who have had travel in the past, and they're being as diligent as the rest because they've seen the notice, they've seen the alert, and they're very concerned. The gentleman at the back there.
19 that are under investigation right now, could we say that they're all self-reported, quote unquote, or how do you guys present that? How would you frame that?
Well, I think the majority, as I said, are in hospital, and it's required that the physician or hospital report to public health.
And did they get to hospital to be hospitalized because of those symptoms, or were they already? I'm trying to kind of wrap my head around the whole thing here.
Yeah, I'm assuming that they had respiratory symptoms. They had to go to hospital. They were feeling unwell.
Can you just clarify those?
The numbers. Sorry, here in
the numbers that you just, you mentioned
Exact question.
earlier that 15, 16 people have been cleared. You just said that 30 people have been cleared. So can you just clarify once more the numbers of people that are being?
The total numbers. 15 have been cleared.
How many in total have been investigated? How
versus
many in
cleared?
total have been cleared? And how many in total are still under investigation? Just those 3 numbers.
So we'll get those accurate numbers for you.
Yeah.
My arithmetic in my head says we've got 15 cleared, 19 under investigation. We have 1 confirmed and 1 presumptive.
Yeah.
But I want to make
Cover
sure
that,
those
that's
numbers are correct for you.
Are these people who are sorry, Dr. Williams, are these people who are on the plane with these 2 people who have contracted the virus, or these different people? I know there was some talk contacting people who were on the plane, so were these people on the same flight?
I would say we don't know if some of them are on that yet. Dr. Davila and their staff are still carrying out the investigation of the ones that are mostly what they consider potentially at risk in that, and their risk basis, as Dr. Davila alluded to, it depends on their proximity to the clients, the cases that we talked about, and whether those are on the list or not. I'm not sure we're open to say that yet at the moment, but I'll ask Dr. Davila if she wants to comment on that.
So I think, I'm going to emphasize the point I made earlier, which is that the major risk factor is travel to the affected areas of China, right? So that's why we have that at this stage of the game. That is the major risk factor. So that's why that's part of the case definition, and it's part of what underpins the testing, what generates the need for testing. So I think that's the major focus we should be looking at this stage of the game.
Okay, but I'm asking about whether these people were on the same flight or a different flight, the suspected 19 cases.
So I think as the investigation proceeds with each of those, we'll be able to better articulate what the circumstances are.
So not too long ago, there are 4 cases of...
Could you clarify on the 19 patients? So you said the vast majority are in hospital, and if they are under investigation, they have to have had a relevant travel history. So are you telling me that, I just want to clarify a couple things. Does this mean that there are more than a dozen, if that's the vast majority, people in Ontario hospitals right now who are showing symptoms and have a travel history there? And how are they being treated? Are they all in isolation just in case?
They are all in isolation with appropriate precautions, which is standard practice now in hospitals for people with fever and respiratory symptoms. If I were to predict, probably they'll all have something else: influenza, respiratory syncytial virus, something else. But we're being extra cautious and precautious on this and saying, just in case, we're testing them.
And their travel history was to Wuhan or to China, can you say?
Well, Wuhan, surrounding areas.
The travel advisory is, as we've alluded to, is to Wuhan, the traveling and the surrounding areas, not China writ large. That's the direction we're given. The gentleman at the back here, sorry.
Telling Global News that there are 4 lab-confirmed cases of coronavirus at long-term care facilities in the province. We have also documentation stating this. Can you confirm whether or not that is the case and tell us what's happening with the individuals in those facilities?
We'll have to follow up to confirm that. I mean, it can be seasonal coronavirus, not novel. We have lots of coronavirus circulating, which is a human form. We don't normally test it because it's usually short course, but now in this current situation, far more physicians, including some presiding over long-term care facilities, may be doing testing in that light. So I can't say in those specific ones because we have not been advised of that, unless it was a novel one, but you have to differentiate between corona and novel corona. And so there is a difference. The lady at the back there.
We're hearing about people buying masks that are flying off the shelves. I'm just wondering, people are afraid. Can you just comment on the usefulness of masks at this stage for people in Canada and whether or not they're actually effective at keeping people safe, even in affected areas?
As we've noted, our protocols with respiratory conditions throughout the season, we've never recommended the wearing of masks in public. Nevertheless, I'm aware that certain other cultures in society like to do so. And one of the problems with wearing the mask is, as both Dr. DeVille and Dr. Yaffe alluded to, is I see people wearing the mask and then they're handling stuff and then they put their hand in the mask and touch their mouth and they do different things like that. It may give that person some solace, but if you're going to do that kind of respiratory protection, it's more important that you don't put your hands up to your face and mouth, which I just did, sorry, but I use hand sanitizer and that kind of thing there. And the mask may not be cleaned on a regular basis, so you actually may be recirculating stuff. So there's a lot of things about the handling that. The same as you do in the hospital, you're very strict about how people wear them and change them and handle them, how they put them on and take them off. So it's not not just a clothing thing to do, because it's supposed to be used for very specific purposes in a specific timeline and disposed of and handled accordingly. So I understand that some groups like to do that. If they want, that's their prerogative. We have never recommended that in Ontario. It's more important to do the other things. I'm not going to go over them again. You've heard them all. To do those ones in there. So that one there. Just about.
Not too long ago, doctors, this government was considering massive retroactive cuts to public health across the province, particularly in Toronto. Cuts are still on the table. But if those cuts had gone through, I mean, would it be a problem fighting this right now, being on top of it? And are you concerned that further cuts would put our ability to handle these sorts of things in jeopardy? Is this a stark reminder?
I think as the minister announced afterwards that there is a consultation process. She's appointed Mr. Jim Pine, who is the advisor, and consultation processes are being undertaken across the province to hear from different municipalities, from public health professionals and others on while she should be advised of how to modernize the public health sector. That process is ongoing as we speak, and that is happening. So that resetting, that re-looking at that, and an open consultation, the minister has already made a commitment to undertake that, and that's where it stands right now.
But have there been any cuts whatsoever that is impacting or are impacting the work that you're doing on this?
I think the important here is that all the resources that need to be brought to bear to address this situation are absolutely being brought to bear. We are doing our fulfilling our obligations to the public, is how I would describe it, in order to address this particular situation, and that's what we're entirely focused on.
How long do those coronavirus droplets actually live? So that gentleman that came back from China, if he were to sneeze on this desktop right here, how long would those coronavirus droplets remain, live or dangerous?
Good question. The Chinese government is undertaking, even in the area that was seen to be ground zero, they talk about trying to look at sampling around there, environmental sources, different things in there. So they're doing that at the same time in there. Because it's novel, we can make presumptions of what coronavirus is like in general. In this specific one, do we know? I would have to sort of say on a presumptive basis, there may be some timelines because viruses have some survival rates, and we can use those. But I really would like to hear what the experts are saying of what they're finding, because they may say in the ground zero area they found some for a persistent long period of time or not. I don't know. So they're still doing that investigation.
What would it be for the common cold for a droplet like that, or a flu droplet? Any idea?
That's a good question. There's many different varieties. Depends on the environment, the moisture, what it lands on, and the size of. I'm not going to say how it sneezes and different materials in, but it depends on a lot of things. So I don't want to be make wide sweep comments.
Wrap it up, guys. Thanks for
Does that mean that Can we just ask one last question?
Yeah, thank you.
Can you just answer, I know that this was asked, but just how many people are you trying to get in touch with on the plane? Is it 3 rows in front and 3 rows behind? Because that's what we've heard.
That is, for this kind of virus, that's the general rule with respect to follow-up, yes.
How many passengers does that?
Okay, thank you.
We'll wrap it up. Thank you.
Thank you very much.